Hello again, I'm Dr. Herman, and in a last video you listened to me talk about your neuropathy condition, the chronic neuropathy condition that hasn't gotten better with medications and shots and whatever else these doctors have tried to offer you. You heard me talk about that there's 4 different components that we have to assess when it comes to a chronic neuropathy, peripheral neuropathy condition, whether it's in both feet, one leg and foot, both hands and both feet. The concerns are all the same. So in the last video I told you about how the human brain may become imbalanced and what we need to do to assess that brain and find out which parts of the brain may be weak and strengthen them. Let me tell you a little bit about the human brain function first. Hopefully you understand that you have a right hemisphere of your brain and you have a left hemisphere of the brain. You have a right cerebellum, which is in the back of the brain, which we can see in this picture right here. That's the cerebellum. And we have a left cerebellum. So we have a right cerebellum that tells our left brain. The left brain tells the right body. You've heard that before, the left brain, right body, right? And we have a left cerebellum that tells our right brain, for the right brain, to control the left side of the body. Hopefully you can get that. That's a simple thing to understand, okay? What I want to show you on this brain, besides understanding that there's a right and a left hemisphere, is to understand that we have a cerebellum. We have in the front here, which is in the front of your head, we have what's called a frontal lobe. We have on the side of the head here, this area is called the temporal lobe, the temporal lobe. We have an area up here, which is right on the top back of the head here, called the parietal lobe. And hopefully you can see this word up here, parietal lobe. And then in the back here, right in the back of the skull, back of the brain here, we have what's called the occipital lobe. Okay, let's understand some things. First of all, when you have numbness or tingling going through your leg or both legs and both feet, we've got to understand that if your feet don't feel normal, if they don't feel like you can stand on them and balance on them and have strength, or they feel numb, or they tingle, or they burn, you've got to understand what those feet communicate with, which is your brain. Your brain may not be functioning normal. Can that be simple enough to get? Let me give you an analogy. You ever see somebody with one of the worst case scenarios that can happen to a human being is a stroke. And in a stroke, you may see the arm is paralyzed or the leg is paralyzed or they can't speak anymore. Maybe they can't hold their bladder or bowels anymore. And the reason for that is it's not that the arm was broken or the spinal cord was cut. It's that the brain that tells the mouth how to talk, or tells the arm how to move, or tells the leg how to work, or the bladder or bowels, whatever the case is in that person who's unfortunate to have a stroke, what happened is that brain tissue actually died. Lack of blood flow and lack of oxygen supply to the brain, and the brain tissue automatically shut off. It died. Okay, so on a less severe case than a stroke, we can have a weakness that occurs in the brain. A weakness of this muscle up here that controls your whole body. Let me use another analogy. If you have a cast, God forbid, you or your kid or a friend or loved one had a cast on their arm or leg for 6, 8, 10 weeks. When the cast came off, the arm or leg was weaker, it was atrophied, it was smaller, the muscle tissue just shrunk, and they have to go for therapy to build up that arm or leg again so it functions normally, right? So otherwise, if they don't, what's going to happen is the arm is always going to be smaller than the other arm. It's never going to be balanced again. Well, understand this, is that the arm is supplied by a part of the brain. So if you're a righty, let's say in this story, that your right arm is not being used anymore to control that left brain or give influence or input to that left brain, what do you think happens to the muscle of the brain? Do you think it's going to be normal without input, or is it going to slow down and become atrophied just like the arm when it had the cast taken off? And the answer is it's going to atrophy just like the arm. I've gone through human brain dissection classes in my neurology school where I've actually seen and have pictures of human brain tissue that has atrophied. So it is true, it is real, and it is something to be concerned about. So what we've got to understand is that we can activate this human brain and we can stimulate it and wake it back up. Now, and there's unique things that we do for that. That doesn't mean, well, I'm doing crossword puzzles every day, Dr. Herman, so why is it that I have a problem? Or I've gone for whatever type of physical therapy to make my legs work on the bicycle, but my legs and my feet are still numb. That's not the point. The point is here. When we look at this brain, What I've got to investigate with you when you come in my office for an examination is investigate your cerebellum. If when your cerebellum is not working normally, maybe your posture is bad because the cerebellum is in control of your posture. The cerebellum is in control of balance. The number one job of that cerebellum of the brain, which is back here, is balance. If you're balanced, if you feel like I close my eyes and I get a little wobbly and I can't stand up, or I fall, or I'm missing my step, I tripped over a step and it's happening to me a lot, you better think that the cerebellum, which controls the muscles and controls your balance and controls your coordination abilities, may not be doing its job. So just understand something. If you can't remember all of that I just said, we have to be able to assess your cerebellum properly, specific parts of your cerebellum, and understand is it doing its job. And that's my job. My job is to know that. Your job is to take care of yourself and get well. Don't just trust in the doctor who says you're okay when you know that you're not okay. Okay? Next part of your brain that we have to understand is this area up here in gray on this drawing is your parietal lobe. Parietal lobe. And that parietal lobe is really important, and it most often goes overlooked, understudied. Did you know that you have two parts of a nervous system? You have a motor control that makes you move your arm or grab your keys or open the door or kick a ball. And you have a sensory nervous system. You have nerves that sense things, that sense pain. I'm touching a hot flame, I'm sensing it. I pull it away, that's the motor control. So you have a motor and you have a sensory system. Did you know that all of the nerves that start in your feet and go through the whole body and your hands all the way up through the neck and so on, those sensory nerves that you feel with, they all have roots somewhere. Kind of like a tree that grows out of ground has roots that go under the soil. Well, they have to get life from somewhere, right? Otherwise that tree doesn't live, does it? Well, the roots of your sensory nerves all originate here. They have roots here in the parietal lobe of your brain. When you go to a doctor who doesn't understand, your neurologist or orthopedist or chiropractor or whoever it is, who doesn't understand parietal lobe function and what he or she needs to do to help you change that function, to wake it up, to have it say, hey, I've got a job to do, or see if it's not working properly, you're missing out. In functional neurology, I understand how to assess the parietal lobe function and change that function. And we can do that. We can wake up the brain. Literally, the brain is moldable. It's plastic. It's able to create new pathways and wake up and do a job again, like coming out of retirement, so to speak. So you've got to check your parietal lobe, besides the cerebellum. Next thing is, we have stress in our lives, don't we? We all do. I know I do. I know you do. I know we don't want it, but it's part of living here on this planet. With stress, we get a certain wind up, a certain excited, stressful nervous system. And when that nervous system gets too wound up from so much stress in our lives, that can be brought on by a number of things, and I'll talk about that in another video, why we do specific metabolic studies on you to understand what's causing the stress in the first place. But what happens is part of your system in your spinal cord gets very stressed. It gets very wound up. And when it gets wound up, there's a part of your brain here that's in green on this picture called the frontal lobe. When this frontal lobe, the whole front half of your brain, has gotten weaker over time, it's not able to calm down the stress signals coming out of the spinal cord. Now you say, well, what do you mean my brain got weaker? Well, let me ask you this. If you were 20 at one point, maybe you're 20 now, maybe you're 40, maybe you're 60, maybe you're 80. I meet people with all ages and genders and race in my practice. So let me ask you this. If you're 50 now, do you feel as strong as you did when you were 20? Maybe, maybe not. If you're 70 now, do you feel as strong as you did when you were 20? Do you feel like you've gotten weaker? Do you feel like you're just not as virile and active as you once were? And most often I hear that people do feel a little weaker than they did early on. So what we've got to understand is if your body has gotten weaker, do you think your brain has gotten weaker? I mean, the brain controls the body, so if the body's weaker, the brain is weaker. Let me tell you that. That's a fact. The brain can actually get weaker and it can get a disconnection of what it's supposed to do. It hasn't had a tune-up. You can't drive a car for 30, 40, 50, 70 years and never tune up the engine. You know that. You've been taught that. Change the spark plugs. Well, your brain may not be sparking or firing its electrical signals properly in order to dampen or inhibit the stress response coming out of your spine area. And what we need to understand is there's ways to assess the frontal lobe There's ways to assess the parietal lobe. There's ways to assess the function of the cerebellum. And there's things that I can do in practice with functional neurology to actually make your brain function better. You'll see videos coming from me of patients who've gone through or are going through my program and who've had neuropathy or congestive heart failure and a number of things who've gotten better. Their pain is gone, they're balancing better, they're walking better, they can step, they have a new spring in their life. And that's all because we look at the various reasons that are causing their neuropathy. I can help you. You've got to understand that it's not a magical pill like a Lyrica or a Neurontin or a gabapentin. Listen, folks, you've got to understand that your brain, this is the next era in caring of a patient. The doctors don't get this. You've got to understand there is a unique way to assess your brain, to assess the different areas of your brain and how they're working or not working, and I can do that for you. I can help you get your feeling back in your legs, feet, arms, hands. There is a way to help you. In this video, what I really wanted to do is just help you get a little familiar with, there's a cerebellum, there's a parietal lobe, there's a frontal lobe that we need to be able to investigate with you and see how the function is. And what I will do with you in my office when you come in for that first exam day is do that assessment and do things right here in front of you to make a change in the brain function if we find out that it's not normal. Okay? Hopefully you get a little bit of information on this video. I look forward to meeting you. Again, my number is 954-370-3100. I'm a doctor who cares, and I can help you stop your neuropathy pain, whether it's diabetic neuropathy or it's caused by the unknown cause that the doctor can't figure it out. I can help you and I can figure it out. I look forward to meeting you. Thank you.